Ever notice how Chris Hemsworth's strong temples give his face a superhero frame? Compare that to Jude Law in his later roles, where temple thinning makes the forehead look wider. Celebs like Brad Pitt and Zayn Malik have maintained sharp temples. Temples quietly help frame our faces. Today we'll discuss the pros and cons of temple hair restoration. I'll show you examples of my own patients and discuss how we help them achieve their aesthetic hair goals. I'm Dr. Gary Linkov, a double board certified hair restoration surgeon. With a practice in New York City, I see people with diverse hair types and goals. And after over 1,000 hair transplants performed, I can confidently say that temple work is one of the most artistic parts of my job. Many people, men and women, who want hairline work often are bothered by the size of their forehead. But remember that forehead size is not just determined by the central height of where the hairline starts. It's also based on the horizontal width of our face, and temples provide framing to the face. They reduce the horizontal width and they help reduce the depth of the frontotemporal corners. Receded temples can widen the forehead and can give a more aged appearance, whereas strong temples can restore symmetry and balance. Because remember, sometimes one temple is more receded than the other. Here's an example of one of my patients in his 40s. He wanted to improve facial framing and wanted to fill in the frontotemporal corners. The angulation of hair in the temples for all people is generally very flat, and proper directionality match is also critical for creating natural results. I use custom cut blades on very thin blade handles to allow me to achieve these very flat angles. This next case shows that we can do temple work for patients of all hair types. So even with curlier hair, nice natural results can be achieved with proper technique. And you can see that for this patient, we've reduced the size of his forehead, not just in terms of its height, but also in terms of the horizontal axis. And that in turn has given his face better proportion and a better sense of framing. This next case shows the importance of using mostly single hair grafts in the temples for maximum naturality. Because our temples do thin out with time, it's important not to place very bulky grafts in that location. And for this patient who had a congenitally missing left temple, you can see that we filled it in quite nicely with about 400 grafts. And that's a reminder that temples can consume quite a bit of grafts. This next case shows that sometimes we use temple work to slightly improve the symmetry from one side to the other. This patient, for example, had a right upper temple that was slightly receded compared to the left. So by placing single hair grafts carefully into that right upper temple, we're able to improve overall symmetry. But it's very important that the temple blends seamlessly into the surrounding hair. For women, design considerations are somewhat different when it comes to the temples. The temples tend to be a bit more rounded in women, and we're often trying to close off that frontotemporal angle, whereas in men, we try to preserve that angle. So as you can see from these examples, one of the key benefits of temple restoration is improved facial framing. This creates a more youthful, balanced type of appearance. And temple restoration can be used to improve overall facial symmetry. Our faces will always have some asymmetry, and that's normal, but sometimes it's a bit pronounced. And when you address the temples, you can often better provide that facial symmetry. And in most people, the right side, for whatever reason, is more receded than the left. So we find ourselves fairly often doing unilateral right temple work. And a properly constructed temple can blend quite nicely with the rest of the frontal hairline. I find that in many male cases where guys are trying to reduce that frontotemporal recession, oftentimes it's better to push that temple forward to close down that angle rather than creating a more rounded corner. Please check out my most recent video on David Beckham's hairline for a more descriptive example of this phenomenon. So what are some cons and limitations of temple hair restoration? Well, for one, this is an aesthetically critical area, and it could be a dead giveaway for someone having had surgery done unless it's done properly. Even in the best of hands, it's possible to have a color mismatch. So the temples tend to gray a bit faster than the rest of the scalp in many people. So when you do a transplant for someone with grayer hair on the sides, and you're taking darker hair from, let's say, the occipital area and you're moving it to the temples, there can be that color mismatch where the transplanted hair is actually darker than the surrounding grayer temple hair. And that's something that some people are bothered by, but most are not. And some will choose to color their hair for a better blending of those two hair types. Also, it's possible to have a caliber mismatch between the transplanted hair into the temples with the surrounding temple hair, because temple hair tends to be naturally a bit thinner. And even when we take single hair grafts from the occipital or parietal scalp and we move them to the temples, they can sometimes have a thicker caliber than those naturally existing temple hairs. And one of the biggest concepts to keep in mind when it comes to temple hair restoration is donor priority, meaning that we want to make sure that we're prioritizing donor hair as much as possible because there's a limited supply of it, right? So if we need grafts to build up density in more critical areas like the frontal scalp, mid-scalp, crown, it's usually better to allocate the grafts to those areas, build them up sufficiently enough first before we start to take a lot of grafts and use them in the temples. I think that temples should be seen as an add-on luxury piece rather than an essential part of hair restoration. Because imagine the scenario of someone having really strong temples that are far forward, but then they have a big area of crown loss. That's not something that we usually find naturally existing. So when I do surgery, I try to create scenarios that could exist in nature. So that's why if someone has other areas that can use the grafts more, I'd rather invest them there than build out very strong temples. And then it just looks out of sync with the rest of their scalp. So we can do temple work with an initial hair transplant procedure if someone has overall very good crown, mid-scalp, and let's say a pretty good frontal scalp, where, for example, we're trying to improve the hairline, and as part of that, we include the temples. But usually these patients are also on some hair stabilizing medications like finasteride, for example, or dutasteride, where we feel confident that they're unlikely to lose any additional hair, and then we can take what they have in their donor area and use a good percentage of it to do this type of hairline work with the temples. So when should we not restore the temples? Well, as I've been saying, if someone has an advanced Norwood scale and they have large areas of the scalp that are just uncovered, it's usually best to delay any type of temple work until we get better overall scalp coverage, and then later on we can maybe come back and add in the temples. But having, again, strong temples and other, large areas of weakness on the scalp as far as hair density goes really doesn't lend well to a great aesthetic overall outcome. Another situation where you might consider avoiding any type of temple work is if someone has a limited donor supply. So most people have, let's say, about 6,000 to 8,000 grafts to give from the donor area over the course of usually several procedures. But if someone has a very thin donor area, or they've had prior surgery and they're down to maybe 3,000, 2,000, maybe 4,000 tops grafts to give, and you have these other sections that are very critical to cover, then usually you'll never really get to the temples, and people just need to accept that they'll have an improved overall state of their hair, but they won't have those really sharp and anteriorly projected temples, and that's still okay. Another situation where we might avoid doing temple work is if someone is chasing perfection or has unrealistic expectations. Really we try to avoid operating on patients like that completely because, they probably will never be happy. This is surgery, this is aesthetic surgery. No one starts off perfect and no one ends up perfect. You can always point fingers at things that are not perfect, and it's those imperfections that usually lead to a more natural type of result. So when I have patients who have very, very high demands where I don't feel that I can meet their goals, then it's better to just not operate, and that's okay. So, I have to have a very critical eye to do this type of work. So when someone has, something that bothers them, I can usually see it and find ways to, surgically, let's say, make it better. But again, they need to work with me and they need to understand that it may not be completely perfect, and that's actually okay. Here's a patient of mine who came in with a very advanced Norwood pattern, and we said that given how diffusely thin he was and the somewhat limited donor supply, that we were going to avoid doing any specific temple work. Instead, we focused on his frontal scalp and partial mid-scalp for his initial procedure, and then he came back for crown work and some additional work into his mid-scalp, and we were able to achieve a very nice overall scalp outcome, but without any specific temple contributions. But he's very happy with his result, and he has no plans to come back in for any temple restoration at this stage. So I apply my root design methodology for all my hair transplants, especially any surgery involving the temples. The temples require that acute angle graft placement. It's that flat orientation of the hair that leads to a much more natural outcome. Also, we need to use mainly single hair grafts, and remember that when we're harvesting from the back of the scalp or from the sides, we rarely get a lot of single hair grafts. So most often my team is actually creating those single hair grafts. So we're splitting hair quite literally under the microscope to take, let's say, a 2 hair graft or a 3 hair graft, or sometimes a 4 hair graft, and actually split it down so that we can get those nice single hair grafts for the most natural possible look at the temples. Also, when we work on the temples, it's important to create a nice feathered, irregular type of pattern that looks real, that looks like it's something that the person could have been born with. If you have like very linear types of rows, then it just looks fake. So being able to create a more staggered pattern is another one of those elements that leads to a very natural outcome. Also, in designing the temples, you need to have the proper positioning on the face. So the height of the temple matters, its relationship to the tail of the eyebrow matters a lot, and also the overall tilt and angulation of the temple itself is very critical, because if it's too straight, then that can look somewhat fake. And if you have it angled back too much, well, then you have a more recessed type of corner that some people just don't want. Also, as far as angulation goes, it's very important to design the temple in such a way that it again flows seamlessly into the rest of the hairline. So that angulation is going to change quite a bit as you go from the flat sort of side of the temple into the central hairline. You need to slowly start to change the angulation and directionality so that everything flows nicely. So even though the temples don't consume a ton of grafts, it's a very high artistic demand area. And that's why I specifically apply my root design methodology to give people the best possible aesthetic outcome. There are some non-surgical options to consider when it comes to temple restoration. One is medical therapy like minoxidil. Some people like to kind of put that minoxidil topically right over the temples in hopes that it will regrow some hair. And sometimes, people see some decent results with that. So that's one thing that people can try. Another is microneedling. So microneedling, we have, extensive videos on that specifically. But yeah, the idea is you're creating some micropunctures and increasing blood flow to the area. And that might lead to some conversion of some villus hair to some more terminal transformation of the hair. So that can help improve the aesthetic if people are, willing and open to trying that. Another option is just like styling tricks. So some people take hair that's further back or further from up top, and they kind of comb it down and forward, and it gives the illusion of having some additional temple hair. One good example of that type of styling is Logan Paul, and we have a video on him if you want to check out kind of how he tends to style in a way that makes the whole forehead look smaller, including the temples on the sides. Another option is cosmetic camouflage with something like fibers, and that you can style in sort of any way that you like for at least the appearance of additional temples. Another way to camouflage would be scalp micropigmentation. We have a video on that concept, and that is something that can be done. It's a temporary type of more superficial tattoo. Not for everyone, but it's something to consider if people are looking to avoid surgery or they just don't have the potential donor supply that's needed for surgery. And some people even get like a hairpiece that could include some temples if that's a priority for them. But nothing truly replicates natural temple temple hair restoration as much as a hair transplant does when it's done correctly. Something that all of my patients get when they have surgery with us is our Feel Confident hair care line. We use custom formulations that I help put together along with an award-winning beauty chemist, and our Root Defense shampoo, conditioner, and thickening foam are designed to maximize your hair. They're backed by science, award-winning, and affordable. Check out feelconfident.com. We've got a link in the description. So in summary, the temples are small but mighty when it comes to framing the face. It's very possible to achieve great results that can create a more youthful, natural balance to the face. There are potential downsides like color and caliber mismatch. The angles can be challenging, and if performed improperly can look quite artificial. And we have to remember the concept of graft economy. We have a limited number of grafts overall, and if we have major areas on the scalp that need coverage and density, it may be best to avoid the temples completely. Of course, not everyone is a candidate for temple hair restoration, and patient selection is key for optimizing results and also patient satisfaction. And temple hair restoration is as much an art as it is a science. Subscribe to my channel if you want to learn more about hair restoration, and check out my discussion on crown hair restoration next. As always, thanks for watching.